Hi, my name is Stephanie Victoria with Healthcare-Edu here. We are located in Massachusetts. So today we are doing the CNA skill in preparation for a state exam. We're doing dressing a client with a weak arm. For our purposes, we're gonna make pretend the left side is the weak arm, but for the state exam, they could say left or right, okay? So I have my board here that my students take a picture to remember all the indirect skills. We have a nice big spacious lab. All right, so let's get started. Here's our supplies. I'm going to assume that my hand washing was already done. If you have not watched that video, please go back and watch it. So I'm actually going in with socks, with a long sleeve shirt, with pants, and a bath blanket. Sometimes I tell my students to go in with Purell and gloves, but in this case, there's already Purell and gloves in the room. So I'm going to knock. I'm gonna pull my privacy curtain shut. For purposes of the video, I'm actually not closing it, but when you go for your state exam, you will have your privacy curtain closed, okay? I'm going to introduce myself. Hello, my name is Stephanie. I'm your CNA today. I'm here to help you get dressed. I'm gonna check my 2 patient identifiers. And notice with checking the 2 patient identifiers, I don't touch the patient because I actually teach my students to do everything having to do with objects first. So what does that mean? I'm going to raise my bed to proper body mechanics, okay? The bed is elevated, all right? I'm going to drop my side rail. And so now once I drop my side rail, I'm engaged with the patient, and make sure you don't go far away from the patient. So I'm Purelling my hands and I'm putting gloves on. All right. So our resident's name here is Tony. So Tony, I'm just gonna cover you with a bath blanket. All right, so I haven't gone anywhere. So I'm going to properly unfold the bath blanket. Okay, so the bath blanket is unfolded. Now what I'm going to do, I'm going to undress. Like I said, in this scenario, it's assumed that the left side is the weak side. So whatever side they say it's weak, you come stand on that side, which I'm on the left side, and you undress the strong side first. So in this example, undressing would be undressing the right side first. Now there's a couple of body mechanics. If you have to lift your patient up, you never pull a tug. You could do the C method. Okay, and so you're going to reach over, you're going to gently, while providing for modesty, undress Tony here. Okay, make sure the bath blanket keeps Tony nice and covered. You're going to roll out from underneath, and the bath blanket is to keep Tony covered. And so we roll away from us so as not to touch your Johnny with the soiled linens. Okay, and it goes right into the hamper, all right? You probably didn't see, I have a hamper right there. So now Tony is naked. So now you're going to dress the weak side, okay, first. So I'm still standing on the weak side, which is my left side, and now I'm going to dress the weak side first. Now, a couple of things. You could start from the foot of the bed and work your way up, or you could start at the top. If you go start at the foot of the bed, you need to put the side rail up, okay? So because I'm just gonna do another step of infection control, because I've taken off the gown, I'm gonna properly take off my gloves. I've gathered it from the middle here, my 2 index fingers, and I'm going to put in the trash, hand sanitize. I'm gonna put my side rail up because I like dressing from below first. And now I could step down. What I'm going to do is put on a new set of gloves. Oops. Put on a new set of gloves. Okay, and I'm gonna bring my pants and socks to the foot of the bed. So again, you only expose what you need. I don't need to completely uncover Tony here. and if there was underwear, but Prometrics just like to see pants, socks, and a button-down long sleeve shirt. So I'm actually going to put my weak side first, which is the left side. Okay, and then I'm gonna go over to my strong side, which is the right side. I have the heel of the sock. Now I'm covering Tony, and I'm gonna work my way up. Now, you have two ways to get this up on a patient. You could have the patient lift their hips. I'm making sure Tony's not exposed. I'm shimmying the clothes all the way up. And so you could have the patient lift their hips off the bed, which I'll ask Tony to do. Can you lift your hips off the bed? Or the other ways, you could turn and roll the patient by properly bending the knee and put one hand on the knee, one hand on the shoulder. But I'm gonna ask Tony to lift the hips off the bed. So Tony's lifting the hips off the bed. Okay, so the socks and pants are on. Next, I have to put the shirt on. So what I'm going to do is I'm going to drop the side rail because I'm up at the head of the bed again. And so I'm dressing the weak side first. So Prometrics, which is the company that gives the Massachusetts State Exam, asks that it be a long sleeve button down shirt. So I'm gonna expose just the arm. Okay, try not to tug and pull. And so you can roll the patient, or you could do that C method to kind of lift up. So what I'm gonna do, let me actually roll the patient so you could see. I'm going to bend the knee. I'm gonna ask the patient to reach for the side rail. I have one hand at the knee, one hand at the shoulder, and the patient is going to actually be turned. Obviously, if it was a real patient, that would be a little bit more smoother. And so I'm going to tuck the shirt kind of over like so and roll back. I'll have you turn back now. Perfect. And so now the shirt's on the other side. You could do that C technique again to kind of straighten it out a little bit. And now you're dressing the strong side. Notice I never left this side of the bed. Okay, be careful not to pull and tug on the patient too much. And now I'm just going to button my shirt. Okay, I'm buttoning my long sleeve shirt. So when I'm done buttoning my long sleeve shirt and remove the bath blanket, Tony will be fully dressed here. I'm actually gonna roll the bath blanket away from me, like so. Okay, you could have put a top sheet on as well, but I'm gonna put the bath blanket here, and now Tony is fully dressed. So again, I'm gonna go into my patient safety, take my gloves off, put in the trash, hand sanitize, and I'm gonna go into my patient safety steps. My patient safety steps are side rail up. My side rails need a little lubrication. My side rail's up, the bed low and locked. So I'm lowering the bed. I'm checking to make sure that it's locked, and it is locked. The patient call light within reach, so Tony has the call light. There's your call light right there, Tony. The patient comfort. So do you want to sit up a little bit? Tony says yes, wants to sit up. The bed is low locked, side rails up. Tony has the call light, and Tony wants to sit up a little bit. And I'm actually gonna come to this side because I noticed the side rail wasn't, oh it is fully up. And here's Tony's call light. I've hand hygiened. I'm gonna open the privacy curtain and exit the room, and I am finished with this skill.